All right, well, our Health and Human Services and Aging Committee meeting is now called to order. Janine, would you please call the roll?
Calling the roll, Mr. Jones,
Here.
Ms. Conwell,
Here.
Ms. Brown,
Here.
Mr. Schron,
Here.
Mr. Miller.
Here.
There is a quorum.
All right. Janine, has anyone signed in for public comment?
No, Mr. Chair, no one is signed in.
If I could have a motion for the approval of our minutes from the July 8, 2015 meeting. Moved by Councilman Schron, seconded by Councilman Miller. All in favor, say aye.
Aye.
Ayes have it. All right, we have one item on our agenda today regarding our wraparound services. Janine, would you please read this resolution into the record?
Resolution number 2015-0143, a resolution authorizing amendments to contracts with various providers for community wraparound care coordination and family youth advocacy services for the period 4/1/2012 through 3/31/2015, to extend the time period to 12/31/2015 and for additional funds, authorizing the county executive to execute the amendments and all other documents consistent with this resolution, and declaring the necessity that this resolution become immediately effective.
All right. And yes.
Daphne Calker, Division of Children and Family Services. We distributed this. It's very personal, and I will be neater next time. I distributed this in case anyone needs a little bit more information. We're requesting permission to amend the contract for 8 Tapestry service providers, which includes 4 care coordination providers and 4 lead family and youth involvement service providers. The priorities for these services are to improve family and youth functioning, reduced recidivism and juvenile justice, and reduce recidivism and child welfare, and increase efficiency and effectiveness. This amendment is for $1.5 million, and it is to carry us up 12/31/15. Any questions?
Are there any questions from the committee?
Through the chair to Ms. Daphne, we just saw some of these names come before us before. So it was for,
We push a lot of services through some of these providers. Yes, we have our CFFS. Part of them, they're also associated with our neighborhood collaboratives. The services are pushed through, yes.
okay. And so this particular one, I mean, just stopping into the center, what do I need, or the agency that's receiving the funding, what do I need to see? What would I see in order to know that these funds are being utilized?
Okay, so it's not necessarily someone that actually has an open case. Part of it can be to prevent an open case. We can service the entire family. A family can be anywhere from a mom and a child, a parent and a child, or it can be 5 to 8 people. So when the services are procured on their behalf, on our end, they're monitored for the deliverables. There's also a monitoring piece with Case Western Reserve also to ensure compliance, and you're pulling some data. I've not seen the data. I don't know how long this is going to take, but there's 2 pieces of monitoring on it.
So when you talk about prevention, is it just wraparound services for anything, whether it's food, resources, things
No,
like
this-
that, or just juvenile?
There's no age limit when it comes to the children. It can be mostly mental health issues, or psychological mental health. It could be a child that has experienced some sort of trauma or something, and the whole family needs to be involved, or maybe just the child. It depends.
So we can, psychological services for the family
Yes.
is one of the, okay. Thank you.
Councilman Miller?
Mr. Chairman, Ms. Daphne, besides psychological services, what other kind of services are typically provided under this program?
There can be community support services where they're putting you in connection with some things that, and like I said, the majority or the priority is to prevent coming into our system. It doesn't involve, like you guys are probably familiar with our collabs, where they go if they need assistance for housing or food or something like that. It could be any sort of service that would be determined that would help keep the family together or keep them in their home.
And this extends a contract that ended on 3/31/2015. Has there been any interruption of service, given that it's been more than a quarter since the contract expired?
Well, what we had done is, when we get to that point, we may not take new referrals, but we do continue to work with the families that are currently involved with the programs.
And why is the extension for less than 6 months from today's date?
Well, I'll be honest with you, we have another extension coming because we're working with our RFP. We're trying to, we're working with new processes with our contracts where they are more efficient, user-friendly. Pulling the pieces together, the monetary piece that was involved in it, we went back and forth. We do understand there's some budget issues and trying to deal with those. What actually do they need versus what they're used to getting?
So this is kind of a stopgap.
Yes.
And how long is the next contract going to be for?
Most of our master contracts average for 3 years, with of course the funding for 1 year. Yes.
And would it be 1 year at a time?
Yes,
Yeah.
absolutely.
So it would be a 1 year contract with 2 possible extensions.
Mm-hmm.
Yeah. And given where we are in the timing, would you request that our committee recommend passage under second reading suspension so this could be passed at next Tuesday's council meeting?
That would have been my next comment. Yes.
Okay.
I'm requesting it. Yes.
Okay.
Let's review those questions or answers to Councilman Miller's question. This extension is through December of this year, the end of this year.
Yes.
Did you just state that the next contract will be for 1 year?
No. Well, the master contract lists a 3-year period, but of course with funding, we're only putting out 1 year at a time. So a contract cumulatively is 3. We don't guarantee the provider the whole 3 years of service.
Have you laid out your intentions after this extension? Is that still in conversation?
It is still, as a matter of fact, we have a meeting scheduled with some of the providers for the RFP.
So let's kind of go back to share a little more. We have a list of 8 providers.
Mm-hmm.
The 4 are our care coordinators,
Mm-hmm.
and then 4 are our lead family services that many of us know right in the community.
Correct.
Such as University Settlement, several others. That has been our traditional model, at least over these last 3 years or 4 years that we have been in office, the Tapestry Network.
Correct.
Tapestry.
Mm-hmm.
So they have.
System of care. That's what
System-
they call it. Get it right. System of care. SOC.
the
They
system
correct
of-
me.
Right, to help our children dealing with everything from mental health, behavioral health issues and challenges. And I'll share there is a conversation going on around reviewing that model,
Correct.
that conversation going around reviewing that model and what we will look to do in the future.
Mm-hmm.
Just so that the committee knows, I have been contacted by the providers, and I've talked with Director Thomas Pristo. Okay, they have been having a conversation around what that new model will look like. So they have been talking, and this extension will give us time to make those determinations.
It will, yes.
To make those determinations, and I was very glad that they had a positive conversation
Up front.
around it, a frank conversation.
Yes.
Because they, based on what the county determines is in the best interest of the children and how we deliver services, there could be changes. And we don't know what that is or what's going to happen just yet, but at least they're all in conversation, the 8 providers. So we will certainly as a committee be watching to see what decisions are being made, what those outcomes will be, and we can, if necessary, if needed, weigh in. And but again, just listen to what is going to happen with our director and these 8 providers over the time period between now and December. December.
Follow
Any other questions, Councilwoman?
up. Through the chair, I just want to understand this. So the amounts that are listed under each provider is just what the contract could be up to, correct? For that individual provider?
Yes, yes.
And
It's what they allocate, but because we're processing it as a master contract, and normally it's based on usage, previous usage. So sometimes we have providers that underperform, But with the master contract, it gives us an opportunity for one that is outperforming, to utilize that funding.
And I don't know if the word outperforming is a good
Over-
word. Maybe not, don't have, the way I'm taking it is that they allocate this money based on prior usage from the families that were in need before, but every year it changes on the needs of the family.
Correct.
So you might not have as many families the next year, which this funding is allocated for already.
Right.
Am I
And-
understanding that right?
Yes, and when I say outperform, like I said, we pool our money now. So you have some that underperform and some that may receive more referrals. So to tell the provider, no, you can't do it, you don't have money. No, the money is there. This is how we allocate it. This is internal.
And you can just amend the contract
Absolutely, yes.
with the master contract. Okay, so that's what and this wraparound, this community wraparound is different than Family First Council wraparound
Yes,
service?
yes.
Okay. Have to get all that clear.
Me too, on occasion, yes.
Councilwoman?
Thank you, Mr. Chair. Through Mr. Chair to Ms. Kelker, the piece that you provided expressed a per diem of $27.74. How does that correlate with the dollar amount? Is that the reference that Councilwoman Conwell is making? Does the $27.74, is that reflective of?
So basing it on prior usage and what we've paid out, it's not a rocket science formula, but on average, it's $27.74 per diem. These are not just for one-day services. These services can continue from anywhere from a week to 6 months to maybe over a year. And when we say per diem, that would be per individual. And like, as I stated earlier, a family could be anywhere from 2 people to 7 people. The whole family may need to, have services provided.
Is there a maximum number on the family? Is it up to 8 or how does?
We would never do that.
Okay.
And that's another reason why it's beneficial that we pool the funding.
Okay. All right. I think that helps. Thank you.
And
Councilwoman?
and this is solely from HHS levy dollars?
Correct,
Based-
100%, yes.
The 4 care coordination providers, as we go through, that is Applewood, Beechbrook,
Sorry.
Catholic Charities,
And Cleveland Christian Home?
and Cleveland Christian Home. And just so we understand, they are the ones that receive Medicare.
Both of them are capable of receiving it, and that's another thing that we are considering with the considerations for the new contract. We're making sure that Medicaid is I'll say hit first before we're billed. Obviously, our reimbursement rate would be different, so that will be part of with the compliance. Medicaid needs to be applied to Medicaid first. Everyone is not qualified for Medicaid, but those that are, they should be referred to Medicaid first.
So the way the current Tapestry model has worked, these 4 care coordination providers bill Medicaid.
Yes.
They receive funding. Do they then pay the other 4 neighborhood centers? Or
That's the conversation that's going on right now. That is what we hope for, to have, what's the word I want to use? Where they're partnering to facilitate a better partnership between the two. Yes, that's the goal.
and my question is really more how the model has happened in the past. The neighborhood providers, they are paid by billing the 4 lead agencies.
Correct, absolutely, yes. The 4 lead agency are qualified to bill to Medicaid. I'm sorry, I get it now, yes.
Okay. And again, that whole concept and model is under review.
Correct, yes, it is.
Okay. All right. Are there any other questions? All right. All right. If not, I will make a motion that we move this resolution to the full council, again, under second reading suspension. Moved by myself, seconded by Councilman Strawn. All in favor, say aye. Aye. Ayes have it.
Did you include in there, Mr. Chair, that it was to be passed hopefully by second reading?
Okay, all
Thank
right.
you.
Thank you very much.
I would ask that Councilman Schron do his PSA, you know, because a lot of families watch this
Oh, yes.
HHS.
Oh, yeah, okay, their little PSA is that for the first time in the state's history, that there will be a tax holiday for anybody looking to buy school supplies, shoes, clothing for schools for their children on the 7th, 8th, and 9th of August. So the first time, now granted, that will have some impact on the county because we will get less sales tax dollars. But the bulk of the sales tax dollars will be saved by the individuals at the state level too. And so I would encourage anybody watching this or recording this to look at how they can be utilizing this one-time tax holiday for those 3 days for the first time ever.
Excellent. Is there any other miscellaneous business?
Yes.
Any other miscellaneous business? If not, has anyone signed in for public comment?
No, Mr. Chair, no one has signed in.
Still no one signed in. All right then. All right. Right.
Before we end, I'd like to introduce Mr. Forbes. I don't know if people have met him. He's an intern. Can you come up and share? He was sitting out in committees earlier today, and I
Is
think
he
yesterday.
available for questions? I mean, I might.
Well, we just want him to
Okay.
introduce himself, you know, so everybody will, you know, the administration hires different people, and you know.
Well, sure. Good afternoon. My name is David Ford. I'm from Cleveland, Ohio, and I'm in the Cuyahoga County Public Policy Fellows Program, which is a 6 to 8 week program that you guys put on to bring in different people from undergraduate and graduate universities to experience county government. So I'm working in the Office of Regional Collaboration with Mr. Kraus and Carlton Laster. So I'll be here attending many of your committee meetings. If you see me around, that's what I'm doing.
All right, David.
Make sure to wish him a happy birthday.
I'm sorry, who happy birthday?
Eddie Cross.
I will do so. Thank you for the heads up.
It was yesterday? Oh,
Yesterday, okay.
And we learned from Councilman Germana and Mr. Forbes is that they're both fellow Bobcats this morning.
Is
So,
that right?
We got 3 of them in our house.
Wow.
all right. So thank
Pleasure.
you.
Thank you.
Thank you now.
Appreciate it, thanks.
All right. All right. Well, if nothing else holds our attention, our meeting is adjourned.
You missed-